Well, three things I think have been important milestones that have advanced the field. Number one, the migration from larger plugs, the 4 millimeter round grafts that were employed, on average contain 30 hairs, 25 to 30 hairs, which is about 12 to 15 follicular units. That created density gradients, from great density to no hair, adjacent. So that it made them stick out, as plugs, pluggy growth. They also limited the naturalness of the result because of that, because they were coarser hair taken from the back of the head and brought when it came to the front line. That's not how a hairline is normally structured, so it doesn't look natural. Another difficulty that the round grafts presented was a problem of angling. Oftentimes they came up at an abrupt angle, perpendicular to the plane of the scalp. The migration to the individual follicular unit permitted the angling of the hair like in 3 dimensions. You could angle, through the exit angle, the exit angle with the scalp and the direction that you give it, and then also a certain tilt. So it's like 3-dimensional, 3-coordinate plane. So you have to envision, because when we do a transplant, we're not seeing the result, and that result won't be evident for months down the line. So you're creating a drawing that evolves over time. And through experience, having done so many and seeing their evolution, you can, develop a feel for what you're doing and what's going to transpire. Another great advance in the past 20 years has been the development of a Finasteride pharmacologic agent to address the hair loss. It has permitted the slowing or stabilization of the hair loss in our patients, so that we're able to restore with greater density the areas that we work in. For example, if someone progresses to an advanced stage of hair loss without the pharmacologic agent, we wouldn't have enough follicles to cover the crown area. So I think that the Finasteride permits the addressing, the crown in some patients.